an early clinical exposure once again, and today we are going to discuss about jaundice. Jaundice arising because of hyperbilirubinemia. Bilirubin, the levels are shown here, zero point 0.1 to 1, that is the normal level of bilirubin, and subclinical jaundice when it is 1 to 3, and clinical jaundice when it is more than 3. So in this early clinical exposure, we are going to study about jaundice just at the cost of repetition. Early clinical exposure, as we talked about, to understand clinical problems through basic medical concepts, or in other words, to obliterate the boundary between so-called paraclinical and clinical. So that artificial compartmentalization is intended to be dissolved, to be obliterated in the competency-based curriculum. And yet another step from our side, jaundice को आज हम discuss करेंगे, and this is the history of the patient. Elevated conjugated bilirubin, near normal unconjugated bilirubin, fecal stercobilin is absent, and the urine is brown colored and the stools are clay colored. So these are the this is the brief history of the patient. So we are going to discuss it through MCQ, 4 options I'm going to give very fast soon. But first, let's generate a bit of background कि ये bilirubin होता क्या है. Bilirubin is end product of degradation of heme. Heme, which is prosthetic group of a number of compounds. For example, most important, it is hemoglobin, the oxygen transporter, myoglobin, which stores oxygen in the muscle, cytochromes, and a number of enzymes also like catalase, tryptophan, pyrrolase. इन सब का प्रोस्थेटिक ग्रुप हीम है और हीम के डिग्रेडेशन से बिलिरुबिन बनता है. The reaction occurs in 2 steps. First, biliverdin formed, second, bilirubin formed. So 80% of this bilirubin is derived from hemoglobin. So hemoglobin is the most important of all. Now let us consider the 4 options. Is this patient suffering from hemolysis, from hepatitis, cholestasis, or there is some abnormal form of hemoglobin? So to understand this, and it is necessary that we refresh our memories. What is conjugated bilirubin? Unconjugated kya hai? And what is stercobilin, which we are talking at the moment. Returning to the slide showing degradation of heme to form bilirubin. So अभी हमने देखा 80% is derived from hemoglobin, and hemoglobin is coming from RBCs. In fact, RBCs are nothing but bags full of hemoglobin. So hemoglobin से heme release हुआ, and after 2 steps it is converted to bilirubin. Now, will jaundice occur if there is excessive hemolysis? Yes, because hemolysis होगा, hemoglobin release होगा circulation में, hemoglobin से excess of heme will be there, and then by the reaction sequence will be pushed towards the right and bilirubin will be released. Now, what type of bilirubin is it? Conjugated or unconjugated? Let us see. This is what we have done so far. From RBCs, hemoglobin and hemi, and more bilirubin is generated. Now this bilirubin complexes with albumin, and this bilirubin albumin complex is called unconjugated bilirubin. So in hemolysis, what type of bilirubin is rising? It is unconjugated bilirubin or the bilirubin albumin complex. Okay. So the first option in hemolysis, there will be elevation of the unconjugated bilirubin. But in our patient, the patient we are considering, there is near normal unconjugated bilirubin level. So this option we can very safely rule out. Before we come to the next option, hepatitis, let us see what is conjugated bilirubin. Unconjugated हमने देखा, it is a form which is complexed with albumin. Please remember, it is complexed, not conjugated. Conjugated means formation of a covalent linkage. तो अब हम देखते हैं what is conjugated bilirubin. Now you see, after this bilirubin, unconjugated bilirubin, it is taken up into the liver cells. It will be taken up into the liver cells where it will be conjugated with glucuronic acid molecules to form bilirubin digluconide. So this bilirubin digluconide, this is called conjugated bilirubin. So I am now repeating it. Unconjugated was bilirubin albumin complex. Conjugated means after it has been conjugated with glucuronic acid. I'm taking a bit of time to clarify this concept. Conjugated bilirubin, the reaction occurs in two stages. ग्लूक्रोनिक एसिड के दो मॉलिक्यूल होते हैं, conjugate होते हैं, and this is actually both the reactions are catalyzed by the same enzyme that is called glucuronyl transferase. This is also called direct bilirubin. Please find out yourself. और स्टर्कोबिलिन का भी हम जल्दी से कंसीडर कर लेते हैं. Normally bilirubin digluconide हुआ, it will enter the intestine by a series of reactions. It will be converted first to urobilinogen, then stercobilinogen, and stercobilin will be excreted out into the feces. Now we come to the next option, that is hepatitis. Is it a case of hepatitis? Yes or no? Unconjugated bilirubin will go to the hepatocytes where it will be taken up into the liver cells. Albumin will be left outside only and bilirubin will be taken up into the liver cells. अब हेपेटाइटिस में क्या हो रहा है? हेपेटाइटिस के अंदर there is reduced hepatic uptake because the diseased liver cells cannot take up the circulating bilirubin. So reduced hepatic uptake will be there. As a result, the bilirubin unconjugated form, इसका level बढ़ जाएगा. So in hepatitis, there is elevation of the unconjugated bilirubin. Now this point, I have seen that the students make maximum mistakes here. So another point which I'm going to emphasize now. So bilirubin जो liver में enter किया, that is less than normal. But the diseased liver cell cannot conjugate it to bilirubin digluconide. That means conjugated bilirubin formation कम है. So the diseased liver cell cannot properly carry out the step 3, that is conjugation to form conjugated bilirubin. So gradually concentration of bilirubin digluconide, it will build up, it will increase. And after certain time, the conjugated bilirubin will, or bilirubin digluconide, will leak out from the into the circulation. तो क्या हुआ? Unconjugated bilirubin elevation तो हो रहा था, साथ ही साथ conjugated bilirubin also will be elevated. This is called biphasic biphasic rise of bilirubin. But are we seeing it in our patient? No, we are not seeing. We are seeing that conjugated is elevated, but unconjugated bilirubin is not. If it were to be a case of hepatitis, then biphasic, दोनों को increase होना चाहिए था. So it is not a case of hepatitis. So we rule out the second option also, hepatitis leading to hepatic jaundice. We have already ruled out the first option, hemolytic hemolysis, also called pre-hepatic jaundice. Now we come to the third option, post-hepatic jaundice. इसका मतलब क्या है? Post-hepatic cholestasis. I'm sorry, we are coming to the third option, that is cholestasis, also post-hepatic. Why post-hepatic? Because in this condition, the problem lies in secretion of bilirubin into the intestine through bile ducts. And please remember, this is the most important rate limiting step of the overall pathway. The secretion occurs against a concentration gradient. तो इससे फिर क्या होगा? This is the slowest step, energy consuming step, and also the rate limiting step. अब अगर जहां पर because of some pathology, for example gallstone, अगर ये obstruction हो जाए, क्या होगा? Bilirubin digluconide or conjugated bilirubin concentration will gradually build up within the hepatocyte. And then after it reaches certain level, it will leak out or rather regurgitate into the blood circulation. So what type of bilirubin will rise in the blood? Conjugated bilirubin. What about unconjugated bilirubin? It should not show, and it does not show any change because the hepatic uptake is normal. The problem is in the secretion. The liver cells are not diseased, so they are able to take up the bilirubin. So उसमें कोई problem नहीं है. So the unconjugated bilirubin will remain normal. One more point. So cholestasis में क्या हुआ? Conjugated bilirubin will rise, unconjugated bilirubin will be near normal. Block here, less bilirubin digluconide, less of formation of stercobilinogen. So this you can see in the figure. This is block complete or partial. तो इससे स्टर्कोबिलिनोजन कम फॉर्मेशन होगा, less stercobilin will be excreted through the feces. Are we seeing the same in our patient also? Yes, we are seeing the same. Fecal stercobilin is absent. Conjugated bilirubin elevated, near normal on conjugated bilirubin. So stercobilin absent, though the feces are clay colored. The feces do not have the characteristic brownish tinge. It is clay colored because of absence of stercobilin. Why the urine is brown colored? Now please see here what is rising in the circulation. As we said, conjugated bilirubin. Now this conjugated bilirubin being water soluble, it is able to take the renal route and excrete it into the urine. So the conjugated bilirubin will increase in the urine. So bilirubin, as we had seen, it is brown colored pigment. So अगर urine में जाएगा तो उससे क्या बन जाएगा? Brown color will be imparted to the urine. So that explains all the findings we had in this patient. This we have done, unconjugated we have done. Why urine is brown colored? Because of bilirubinuria. Why stools are clay colored? Because of absence of stercobilin. So I think that completes. This figure shows in a more explicit manner everything. So we will see only this post-hepatic यहीं पर block है. So no stercobilin, no urobilin, etc. But the rise is in the conjugated bilirubin. Fourth option, this is just for completion's sake. I had said gallstones are important cause. Another important cause of cholestasis is carcinoma head of the pancreas. The fourth option is very simple, abnormal hemoglobins, HbS, and a number of others also. There is increased hemolysis. So this option is same as you can as hemolysis, the same finding. So this we have already ruled out. So this also, fourth option also, we can rule out. So I think that completes now one advanced learning point. I will leave you with a problem. In hepatic jaundice, there is less secretion of conjugated bilirubin, less urobilinogen will be formed, but urinary excretion of urobilinogen increases. By logically speaking, it should fall because less conjugated bilirubin is entering the intestine, यहाँ शो कर देते हैं, यहाँ पर भी less is the formation of bilirubin digluconide, less bilirubin digluconide is entering here, less will be the urobilinogen formation. So logically speaking, less urobilinogen should be in the urine, but it is increased. Why is it so? Thanks.